Thanks for joining the R.O.Hammer Company's podcast. I recently had the chance to sit down with Sjorn Lundquist, Chief Growth Officer at Accelerated Claims. Sjorn has over 25 years in healthcare revenue management and is a genius when it comes to streamlining workflows and helping providers boost their bottom line. I'm a big fan of Sjorn's. I hope you enjoyed the conversation. Hey, Sjorn, thanks for joining. How's it going today?
Real good, John. Thanks for having me.
Absolutely. It's been a while. It's always a pleasure anytime we can connect. Are you in Minnesota today?
Yep, here in Plymouth. It's a beautiful spring day out. Are you down in Atlanta right now, or?
I am in Savannah, Georgia for another, I don't have a definitive date yet, but probably another week and a half to 2 weeks. And then I am making my way back to the land of ice and snow as well.
Awesome. Well, we'll be here with some walleye fishing and an iced tea on the deck for you when you get here.
That sounds great. So for those of viewers who don't know you, interesting first name.
I'm Swedish, and
No.
probably can credit my hippie parents for giving me a proper Swedish name.
I am also Swedish.
I respect and appreciate that about you, John.
Yes. For those, I guess, who don't know or have never heard the name Sjorn or know little about Minnesota, there are a few Swedes. I believe that Minnesota is actually the largest concentration of Swedish people outside of Sweden in the world.
I think
so
a lot of Swedes and Germans up here, no doubt.
Yes. Yeah. Good stuff. Excited to talk about quite a few things. Want to dig into accelerated claims a bit, but let's kind of start from the beginning again for the benefit of people who don't know you. Want to tell us a little bit about your background?
Yeah, absolutely. So I think when we're speaking specifically of outsourcing collections and revenue cycle, I got into this business in my early 20s, fell into it, needed a job, and knew somebody at ICOR, and ended up my first job was working in student loan default prevention. So I was on the phone talking to student borrowers about programs that were available for them to stay out of default. And fast forward, gosh, I don't know, almost 30 years now. It's crazy how the time flies. But
it does.
Yeah, but I've been in healthcare rev cycle for about 25. So I started my career in student loans and financial services, primarily in debt collection. And then around 2000, joined PSB Mars. Had a great run there, great company. And that was really my entry into healthcare, really kind of across the revenue cycle. But my work there was primarily in insurance denials, early out collections, system conversion, kind of BPO outsourcing for health systems. And then after about 20 years there, I joined Capio. May have seen that recently. I think when you and I reconnected, I was over there.
How long were you at PSB?
I was at PSB for about 20 years. So
wow, I didn't realize it was that long. You're very humble too. I kind of watched PSB went from a smaller to what was the employee count when you left?
Yeah, I think so. I was employee number 8, and PSB had been around for a couple of decades when I joined, but I was the 8th employee at that time. They had grown and shrunk over the years, but I think when we left, we had around 400 FTE working both sides of both first and third party across healthcare. Yeah, it was an exciting run.
Yes, impressive. Yeah.
And, that was kind of during the time when health systems were really beginning to outsource patient billing, insurance follow-up, and especially early out customer care. And so we were really at the forefront of a lot of that work as that kind of became a norm in the industry. Timing is everything, right? And I think one of the things that I've enjoyed, whether it's at PSB or Capio and now at ACI, I've found and in trying to find them, but it's been great to work for companies that are pushing innovation and willing to invest to really continue to optimize what they're doing. And I think as I look back at PSB, Capio, and now ACI. That's certainly a common thread, which has been exciting because it gives me the opportunity to do what I do and be creative and really solve problems, right?
Yeah, that's great. I know that about you. I think you're drawn to that. I think I am as well too. It'd be tough for me to have a normal 9 to 5. So those types of companies are right up your alley. That makes sense.
Yeah. Well, and I'll tell you, John, it's interesting, and I don't know if this was intentional, but I've had the pleasure of working for privately owned companies primarily, and I think there's a great opportunity in the private equity side of outsourcing, but I've really enjoyed the private ownership and all the benefits that brings, right?
Yeah.
Oftentimes you wear many hats as you're growing, but it's been a great run.
The purpose of this conversation is not to spend too much time on previous companies, but you did some big things at Capio too. For people who aren't aware, tell us a bit about what Capio is about.
So Capio's in a unique space. Their model is pretty straightforward. They purchase patient bad debt, but Capio is really built around then using that solution to create affordability for patients, which was really a big reason why I went there. Again, privately held, and had a chance to both provide sales support and sales activity as well as some sales leadership in my time there. And again, great team. I think like you and I were talking a few weeks ago, I think it really ends up being who you work with, not what you're doing, right?
Yep.
And like at PSB and Capio, just great teams, innovative folks looking to create solutions that don't exist, and that was a lot of fun. Certainly a challenging market, in healthcare collections today.
Yes.
But I think they've got a really unique product that I think will continue to serve that market. And really, again, back to everywhere I've been, it's really been about, finding companies that build trust. And I think I've gravitated to those that really focus on relationships and trust. That's been a nice place to be for me as I've gone through this process.
Yeah. Well, I know you better maybe than most, and I applaud you in your ability to think outside of the box. We recently reconnected, and you've been instrumental kind of working on a side project that we're involved in, a software product. Definitely have brought some ideas to the table that were not something the rest of our team was thinking about. So I'm sure that your current and previous employers and partners are very appreciative of that. Let's segue there. Speaking of kind of outside of the box, let's talk about Accelerated Claims. Brilliant company.
Yeah.
I've gotten to learn a little bit more about them in the past weeks. Want to give us a rundown?
Absolutely. So I just joined ACI recently, just actually about 2 months ago. So still new to the company, but man, so excited to be here. When I was looking for the next opportunity, really ACI kind of just came together through a mutual professional connection, and really discovered that they've been really leaders in this space for 20 years. So if you don't know ACI, we solve complex claims problems for health systems, really primarily in motor vehicle and workers' comp, which is a challenging space if you're not familiar. The regulatory environment is complex. Billing rules are different than commercial and government claims, and this piece of the revenue cycle has an outsized work requirement for relatively low reimbursement for the hospital. So it's a true challenge. I think what's great about ACI is that, especially in this space, you can't do the work without great technology. And I think that's really been where this space has evolved, is finding ways to leverage technology to do the work cheaper and faster, which is true, and we do that really, really well. But what's different about us is really the human component, and really the human approach that we bring that really leverages that technology to drive better performance. I think watching technology evolve, whether it be RPA or AI, continues to be at the forefront of what we do, and I think what others do in this space. But it doesn't replace that human expertise that you get from being a trusted leader in the space for so long, and really being experts in the business. And I think, that day may come where the human element isn't critical, but what we know here is without it, systems continue to struggle. And so I love that about our organization.
What has been from a technology like RPA or machine learning, where are you seeing the most traction? Is it just replacing manual processes, or where are you guys getting the biggest benefit to date?
I think the challenge in complex claims specifically is really in identifying all of the patients that were either injured in an accident, either at work or in a car, right? And a lot of that information is readily available, and patients provide it when they come in for service, but much of it is also not provided. And so I think as hospitals look to outsource specifically this piece of the rev cycle, one of the things that they're doing is gaining access to technology that they don't have, right? To identify those patients quickly, and then create efficient ways to follow up and actually recover those funds. What I think we're seeing more and more today is that RPA and AI can do a great job of segmenting and prioritizing the work, but there is still a critical piece of the process where humans have to then take that information to then complete the work. And I think some of the challenges is that with that complexity, that RPA doesn't have the depth or breadth to complete the work, right? So I think that's where we're seeing the biggest opportunities and the biggest challenges. And with automation comes, health system integration continues to be a challenge for health systems.
Have you seen? I'm sorry, I didn't mean to cut you off.
No, go ahead.
So, in the arm space, I think this is for those of us who work with hospitals and health systems and banks. Yes. So, in the arm space, I think you're singing a familiar song. A lot of us are dealing with the same integrations and build-outs. Are you seeing with the hospitals and health systems that you're working with any pushback about these types of automations or compliance concerns or anything like that?
Well, absolutely, and saw it extensively in my time at PSB and Capio as well. And I think look, security and compliance is at the forefront for every health system, and I think it gets back to trust. I mean, you have to have security, and you have to have certifications that prove that security, so that you're holding that data in the proper way. But I think even beyond that, a lot of the CFOs I talk to, they say a similar thing, which is all these outsourced companies are going to save me lots of money and perform much better than I've done in the past. And I've got 12 companies lined up to onboard to do just that. So even if I have a need, the challenge is, where are the resources? Where is the time to truly onboard those projects in the right way? Because, like any project, if it's not done properly up front, it can be a failure right out of the gate. And I think with all the complexity of technology, that's even more true today, right?
Yes.
And so but I mean, more broadly, I think the question that they're often asking is is it cheaper to build it or buy it? And I think a lot of the automation and AI and RPA that we talk about, it does a great job when it's working well, if it's working properly. And when it's not, it can create even bigger issues than they've had before. One of the things that I heard recently that I just love is, if you have a partner tell you that technology can solve all their problems, you probably want to run for the hills, because it's not quite there yet. It's a critical piece, but it's not the panacea that we want it to be just yet.
Yeah, I think a lot of I think it's important that people are beginning to act. Can no longer be a someday maybe type of thing, but I think a lot of people look at it as you're going to automate all these processes and maybe reduce FTEs. And every life will be, somebody has to manage all of the automation for when they inevitably do break down. It's probably more accurately a pivot to a different looking staff than anything.
Well, it's interesting you say that. I was just talking to a colleague in the physician space and a large physician group nationwide, and they recently realigned their internal leadership. So their chief information officer now heads their revenue cycle recovery strategy.
Yeah.
As they've moved to such a digital forward, technology based patient and billing engagement strategy that it just made more sense to have a technology leader leading that department, which really tells you really how far we've come, in relying on tech to do the work.
Yeah. And if you went back 10 years ago, how many claims processing companies had data scientists? Like, did that role exist?
Did the word data scientist even exist? Right? I hadn't heard that, right?
Yeah, it's interesting. I think we live in exciting times. I think you're right, though. There's a long ways to go for a company like yours, and I'd be interested if you're willing to share how there's it's one thing to automate with RPA manual functions. It's another thing to do it at scale. We're dealing with high volumes and lots of variables or potential situations that don't fit the mold. How have you navigated that path, and what type of volume of claims are you guys processing?
Well, that's a great question. What I can say is that we process millions of claims a year, and serve millions of patients across the U.S. And really are key to the success of many of the health systems that we work with in that particular area, right? And at ACI, we work with systems that are multi-state, many hospitals and hundreds of clinics, down to independent hospitals serving an individual community, right? And I think as we look at how those projects scale, some of the challenges, and I think this holds for health systems and for partners like ACI, we have proven solutions and proven strategies that work. The challenge is integrating with the health systems that we work with and creating synergy, I hate to say the word, but synergy between what the health system is doing today and how we as a partner can help enhance that, right? And I think, as much as there are similarities across healthcare specifically, every system is different. Even if you're all on the same EMR, they're all configured differently, right? And so that requires customization, which then I think creates challenges around that scaling and that automation, right? And which just gets back to the fact that as we look to where is ACI different, right? And how do we differentiate in this market? It really comes back to the human expertise. Because I think to be, to be competitive in this market and as an outsourcer, you have to leverage technology. But the question is, what do you do with that technology, right? And what do you do with the employee training and the retention of those employees? And how do you create true partnerships with the systems you work with? I think that's what we're really getting at, is how can we partner in a way that changes the outcome and frankly solves the challenges that they have up front, which is they're looking often to reduce cost. We see reimbursement being cut across healthcare, whether it be government reimbursement or private insurance paying less for the same service. Health systems are under a lot of pressure, and that inevitably means their first goal is to cut cost. And so our challenge as an industry, I think, is conveying the value of performance while also reducing cost. And sometimes those two are in conflict, right? And there's that.
Yeah.
You do need to invest to perform, but you have to do it competitively. So I think the industry is currently really at a not at a crossroads, but there is, as we adopt new technologies, that is changing the market. And I think companies that adapt and evolve and continue to be flexible are going to succeed, and those that they solve one problem and it's our way or the highway, they're going to struggle.
Yeah, the ability to be nimble, I think, is what you're getting at, and I would agree with you
Absolutely.
wholeheartedly. Um, are you, again, for uh, those out there who aren't familiar with the claims processing model, are you able to share about how your uh, pricing structure works? Is it per claim? Is it a contingency basis? How are you generally uh,
Yeah.
work,
So
working for your
yeah,
clients?
great question. So in complex claims, generally speaking, it's a contingency based model, right? And there are different ways to structure that, but like most outsourced services and revenue cycle, percentage of what's recovered is the fee. And so I
Hmm.
think that that does a good job of aligning the partner with the health system, that performance drives revenue, and I think that's always been key. What we're seeing also though is, and I think as health systems become better at identifying their own opportunities, we're very much seeing new ways of aligning the partner motivation with the health system deliverables. And I think we'll continue to see new ways to incentivize performance. And so as we see that technology impact what vendors and partners are able to do, I think we're going to continue to see that pricing model shift and evolve, to really get at the core goal of these projects, which is, again, to collect more money faster and create a better patient experience.
Okay, that's great. Yeah. So I have to ask, this is a common question for a lot of guests on this podcast. You mentioned that performance drives revenue. Analytics, very hot topic right now.
Yeah.
We've gone down a tech rabbit hole here. Are you able to speak to what type of performance analytics you're currently using to optimize your performance, and if you're using any tools, proprietary or other, if you could share, would be great.
Yeah. Yeah, absolutely. And I think, first and foremost, a company like ACI, so our whole model is built around transparency, right? And I think, more generally, companies that are focused on walking the walk, talking the talk, and showing what's happening, whether it's good or bad, are really the organizations that are going to succeed long term. We put a major focus on providing that transparency. I think it gets back to what I mentioned earlier, and that is that health systems are not only hiring us to solve a problem, they're hiring us to bring technology that they don't have access to. And that technology also includes a ton of insight that can inform and empower those healthcare leaders to create change upstream. Every step of our revenue cycle is the result of a previous action. And I think as we all work to do our work in whatever space we're in, for us it's complex claims, we identify opportunities to correct that action upstream. Whether it be registration issues of missing patient information, or misclassifying an account that could have resulted in higher reimbursement for the health system. Those are the insights that I think we are able to bring that the hospitals simply don't have access to. And I think the other thing that's important is not only identifying those outliers that are true opportunities, but how do you solve those challenges? Right? What is the solution to the problem? It's one thing to say you've got an issue, and it's another to say you have an issue, and here are some areas, or here are some ways we've seen others fix that. Right? But back to the data, I think at ACI, some of the key process indicators that health systems continue to focus on is AR days, reducing bad debt, and reducing their cost to collect. And that cost to collect is specific to every step in the revenue cycle, whether it be registration authorization, to coding and billing, to billing and follow-up, appeals, early out collections, across the board. Having that insight and sharing those potential fixes, I think, is key. At ACI, we provide a vast array of reporting that really gives our partners deep insight into the daily activity that we're completing on their behalf. And I think it really demonstrates really the depth that we go to at ACI to perform. And I think that it's an opportunity for us to really demonstrate how much work we do to perform for the partners that we work with. We're very much a customer and employee focused company, and a lot of people say that, but I think what that means is we're focused on creating an environment where we have retention, so our employees stay. We've seen huge value in that. It creates better outcomes for our employees, and we deliver better work. And I think that retention then is reflected in the experience our clients receive from us, right? They have happy employees that are knowledgeable and committed. And I think all those things together make for long-term partnerships that we're all looking to create, right, in this outsourced business.
Yeah, that's great. Where is ACI headquartered?
So we're in Kennesaw, Georgia.
Okay.
Yep.
Okay.
So
yeah,
down near you today there, John.
Yeah, that's
Yeah.
great.
Yep. But yeah,
That's
we
great.
have our headquarters are in Kennesaw. We have operations centers across the country. Much of our, all of our staff is onshore. I think that's something that we really pride ourselves on, with the complexity of the work that we do. So that's a key component for us is that our staff are in the communities of the hospitals that we serve, and really are, become part of those teams for the health systems that we're working with.
Sure. Let's talk about that for a second. The complexity of the processes. You mentioned obviously for your hospital and health system clients, cost of collections is a component. Maintaining staff with the requisite level of expertise, I'm sure, is a factor. What are some of the other kind of challenges that these healthcare providers face that make ACI a more viable option than trying to process the claims internally?
Yeah, great question. So I think first and foremost, it's expertise in a constantly changing small piece of the revenue cycle. Regulatory changes are continuing to evolve and change how hospitals are required to bill and process these claims specifically. So I think when we think about compliance, that's a huge piece of what we bring to the table as a specialist in this area. And I think, like other areas in the rev cycle, complex claims are very unique in that EMRs are not necessarily built to manage this specific workflow, right? And so what we see is health systems that are currently managing this process in-house with an internal team. They're trying to modify a system to do a job that it was never really intended to do, and so there's a lot of inefficiencies in the process, and frankly, specifically in complex claims, there could be a long window before the health system gets reimbursed, right? And they're very focused on new patients that are coming in, ensuring that those are billed quickly, and complex claims can become a drag on their workforce, right? And so I think, for ACI specifically, that human expertise that we bring, I think, is what is so invaluable for the systems. Now, what we're able to do with that expertise is drive better performance, which then in turn lowers your cost to collect. So I think it's it's not one or the other, but it's both together drive the kind of results that health systems need and are looking for.
Okay. Does ACI have any plans to move further upstream and offer additional services beyond the complex claims, like more traditional billing and coding?
Yeah, that's a great question.
I ask the hard questions here, Sjorn.
This is hard-hitting podcast here, John. We're getting into the nuts and bolts of it. We get asked that all the time, especially from our current partners. And I think that's a natural question. Today, we are focused on being the premier solution in complex claims. We also provide healthcare billing and follow-up on a limited scale where it makes sense, where it's a partnership. But our organization has had a lot of success in this space. I think we're continuing to focus on that. As those opportunities present, we're certainly continuing to look for ways to expand the service and the work that we're doing.
Sure.
Short version is we are really good at what we do, and today we plan to continue to lean into that.
Okay. Yeah, that's great. It's always interesting when clients are asking if you're willing to take on additional services. It means that you're doing something right. So that's a good thing. From claims management or even like healthcare finance in general, pull out your crystal ball. You see what do you see for the future? Anything exciting or challenging ahead?
Man, that's a great question. I when I talk to CFOs and technology leaders and rev cycle leaders, I think the great unknown is broadly what's going to be the impact of Medicare and Medicaid reimbursement cuts. How is that going to impact their overall financial structure? And how do those impacts continue to burden patients with high out-of-pocket costs? I think the challenge for our industry and really for our country is what are we going to do about the rising cost of healthcare for folks who just simply can't afford it? And I think health systems, they're doing their best, right? But they're under extreme financial duress. Reimbursement from commercial insurance companies continues to go down, and what's happened is, as a matter of necessity, they've raised their prices to continue to receive equitable payment for services. But what that means is that patients are left with higher out-of-pocket costs, especially those who aren't insured. So I think the focus for health systems is going to continue to be on automation and technology. My hope is that it drives a change in how that impacts patients. But at the same time, John, I'm an optimist. I think we've got, it's a small community of a few thousand people running all of healthcare in the U.S. essentially, and there's some great minds. I think we have the solutions in place. The question is, do we have the will to make the changes we need to make, right? And
yeah.
I know that's not being too specific, but I do think that it's
a complex issue.
Well, it's a complex issue, right? And we continue to invest huge money in leading technology that saves lives, and I wouldn't want to see that change, right? And so I think it's an exciting time to be in healthcare, right? For people looking for a challenging career that is constantly changing and unpredictable, if that's what you're into, healthcare revenue cycle. It's where all the action is today, and it's an exciting time,
It is an exciting time, and it's a challenging puzzle to answer. I tend to agree wholeheartedly with the majority of your thoughts there. It's kind of trying to reach that delta of quality of service and cost for the patient. I've been fortunate enough. I've spent kind of a significant amount of time in the UK over the last couple of years, and I also have relatives in Canada. People want to be here and use our health system from all over the world, and there's a reason for that.
Exactly.
I'm not saying that the model is perfect or that it couldn't be better. I think there's a saying about democracy, like democracy is not the best system, it's just better than anything else.
Right.
Yeah, and I think that kind of holds true to our current healthcare, but hopefully I like your optimistic outlook on it. I think there's still work to be done, and hopefully people will stand up and will find that appropriate medium that allows quality care and great pricing for the users too. So
well, and I'll tell you what, I think that AI, and I know this is maybe a bit cliche right now, but I do think AI is going to transform how we deliver care, how we as partners deliver service. And I'm excited about the potential that it has for patient care and for our ability to do good work, right? Even at ACI, right? All of that it is exciting, and I think it will lead to positive change.
Yeah, I agree.
We're building an airplane while we fly it is the challenge, right? If we could just start from scratch, we could probably solve some big challenges, but we're building it while we fly it, so we got to be careful.
Sure, sure. Anytime I get C-level participants on the podcast, like to pick your brain about operational type stuff. What are your kind of key priorities for the remainder of 2025 and into the near future?
Yeah, great question. So I think first and foremost, it's ensuring that at ACI specifically, that we are responding to our customers' needs in the way that they expect, and we do. It's been so exciting to come here and learn about all the great relationships that we have. I think that is key, right? You have to make sure that you're taking care of the folks that are working with you today, and I think we do a great job of that. But I'm looking forward to continuing to focus on that. I think asking questions about what other challenges they have, right, and how we can be a resource, I think is an area of opportunity specifically for us to be a resource, even if it's not in complex claims, right? This is a network, a community of professionals looking to solve different problems, and I think if we can be a connector there's value. I think for ACI specifically, we are very much focused on really growing our organization, leveraging the success that our team has had for the last 20 years. We've got relationships with some really large, great health systems, but really helping share that story, right? And leveraging those successes to continue to expand our footprint and but while continuing to drive positive outcomes for our customers. And I think that's the challenge as you grow, is to retain what makes you special while you scale that to a broader audience.
Yep.
And I think so as we look at that at ACI, it's going to continue to be investing in technology that allows us to stay competitive, investing in our people, which is really at the core of our success. And we talk about it every day. It's what makes us special. We don't just sell technology. We leverage technology to empower our humans, and that's what's great about us. So I think investing in that employee engagement is key, and creating a positive environment for our employees, right? I mean, people have a lot of flexibility and options today. With work from home, you can work for any company across the country, right? So we're not just competing for employees locally, we're competing nationally. And at a certain point, you have to give your employee a better day-to-day experience, and I think that's key to our long-term success as well.
Yeah, no, that's great. It sounds like a very thoughtful approach, and I'd like to kind of dive into that just with one more question. Is it challenging building teams and scaling teams in such a specialized industry? Kind of what's your approach there?
Yeah, absolutely. And I think as you could imagine, when we're hiring at ACI, we don't post a job for an experienced work comp or motor vehicle claim processing specialist because those folks aren't out there looking for work. Everything we do is we hire and then we train. And I think there's some benefits to that, right? You can train employees exactly to your culture and your standard. At the same time, oftentimes, we're building knowledge base with new employees really from the ground up. And so the approach that we've taken is we're not going to rush a project with unprepared staff. It's not good for our customer, and it's especially not good for our employee, right? You want to lose a great new hire, put them in a job without preparing them or giving them the tools. And so we're very committed, and our operations team is really second to none. The structure that we have here really just has robust employee support, from our training to our leadership vice president team, all the way through compliance. And so our approach is we're going to take a little longer to train in new staff, but we're going to ensure that when they begin their work, that they are at the quality level that we would expect of someone who's been here for years. Now, they're not going to have the depth and breadth of experience, but they're going to be able to do ACI quality work when they start that project.
That's great.
So what that means for us is, again, we've been doing it for 20 years, so we've got proven training strategies that work, and really, using technology to help inform and educate and empower our teams. That's really the future here at ACI, is with the complexity, is giving them those education resources in their daily work to empower them to make the right decision. And then having checks and balances to ensure that those decisions are happening properly. Those are the kinds of things that we're focused on to ensure that the quality product at the end of the day remains at the level that ACI continues to create expectations, right? Does that make sense?
Yeah, no, 100%. I know that when you're dealing with complex, compliance-laden processes, setting aside the employee educational component of it, there's also oftentimes some educational or compliance hurdles on the client side in order to kind of optimize the processes or services that you're offering for them. If you were giving advice to, a prospective end user of your services, what would the advice be to ensure, one, a smooth transition, or just better success, more recovery on these complex claims?
Well, I think the advice would be really for us, and that would be we need to be listening and really understanding what the true challenges are in their workflow today, whether it be technology, humans, or process. Because I think the challenge can be so broad to just say, well, it's not a process we like to work on, right? We struggle to put staff on it. They don't want to do it. They want to do other things. And I think that doesn't get to the root cause of what is the true challenge here. If it's about staff retention, then we can talk about how we can help you with education, how we can help you with insights into what helps us retain great staff. If it's about technology, and this gets back to being flexible, we need to understand what does that workflow look like today, right? Let's take a look at the Visio and see how things flow. And oftentimes that's where we can identify opportunities for improvement. But I think it really starts with truly getting to the root cause of what those challenges before we can come up with a solution.
Yeah, that's a really good answer. Well said. It sounds like it is a true partnership. I think in this type of business, anytime that you have mutual success, right? If one side does good, the other side does good. That's what you're shooting for.
Yeah. I think to close that loop, it's great to listen, and I think it's key. But how do you solve those problems, right? And it's a great time to be in this role at ACI because we've got the longest tenure of any provider in any solution in this space, and I think that gives us a great platform to be that trusted resource. Because it's one thing to listen, but you have to be able to provide solutions, and I think that's what we're all really trying to get after. And what's so exciting about ACI is that we've been able to do that consistently, and that's different for every client, right? That's different for every customer. And John, the truth is sometimes we can't, right? And I think the key there is to say, based on the challenge you have today and what you're specifically looking for, we might not be the best solution, right? We may have a different solution, but if that's what you're looking for, we're going to tell you that's probably not a good fit, right?
Yeah.
I think that having that integrity is key long term.
I would agree. We're coming up close to the end of our time here. Is there anything new or upcoming that you'd want to share about accelerated claims?
Well,
anything exciting?
I tell you what, we are so excited. We've got, I've mentioned a few times we've been in business for 20 years, and a lot of great partners that have been with us that whole time. We're looking forward to celebrating them later this summer with our 20-year anniversary. We've got some exciting updates to some of our website material, and so look for some of those changes in the coming weeks. But to be clear, we're not changing who we are. We're just clarifying the story that we're sharing that makes us special. So
that's great.
Look for that.
I like
That'll
it.
Be exciting, absolutely. But we'll continue to be out there, sharing the good word, supporting our revenue cycle trade organizations, and continuing to be a leader in the space.
That's excellent. Are you going to be making any trips to Sweden anytime soon?
Yeah, sure. Yeah, sure. Just you betcha. No, full disclosure, possibly next summer. My oldest daughter graduates college. She'll be a senior in 25,
Congrats.
26. So we are kicking around, possibly taking a trip through the homeland. So
That's excellent. I'm headed there this summer again. We to visit relatives with it's going to be just my dad and I this time. So kind of excited for that trip. Borrow relative's car and kind of do some touring. So
standing, John. We'll have a great time. Send back some lingonberries or something.
Yeah, will do. For those of you who haven't been to Sweden, visit Minnesota. It looks it's basically exactly the same.
Right.
Yep.
Yeah. Come to Minneapolis. We've got great sports teams and nice weather in May.
Yes.
We'd love to have you.
Yeah. Well, thanks again for joining. You want to tell people the best way to get hold of you? Get in touch?
Yeah, absolutely. Love to connect. My phone is 763-355-7773. Or you can reach me on LinkedIn, or my email is slundquist@excelclaims.com. So, John, thank you for making the time for us today. I appreciate it.
Anytime. It's always a pleasure.